You, doctor?
Wa alaikum salam, Mr. Ali. Nice to meet you and happy Ramadan for all. And may Allah accept us in this month, inshallah.
Yes. And also, we want to mention that he is a professor of plastic surgery at Al Azhar University here in Cairo, Egypt. So let's open the discussion, Dr. Mustafa. Let's talk a little bit about, well, let's start with obesity itself. We should make a distinction, I think, between being overweight or heavy and obesity. This is a special designation. Can you talk about this?
Yes. Obesity is recognized as increase of body weight above its ideal form. And we have an equation. By it, we can count how much overweight you have. Okay, this equation stated that your weight in kilogram divided by your tall in square meter and timed by 100. This will give us a number. This number can give us what overweight you have.
Okay.
The ideal number, it should be around from 18.5 up to 24.9. This is your ideal weight. Yes. If before from 2.5 up to 30, almost 30, so you are overweight. From almost 30 to 35, you are obese. 35 to 40, you are over obese or super obese. Above 40, you have morbid obese, and this is a critical point.
Yes.
Because you will have problem with your heart, with your body muscles, your skeleton, your brain, your eyes, and you'll be exposed for diabetes and hypertension and so on. This is the equation for classification of obesity, as we can see here.
Yes, this is an illustration of your the equation, the BMI,
body mass index. Yes.
Okay. All right. Once we know our BMI, you know, each of us has our own BMI. How important should it be for us, and what should we do with it once we have it?
As I stated, this gives us a critical point, a critical threatening that you have a problem, and you have to solve this problem. Otherwise,
it should. I'm sorry to interrupt you. It should raise a red flag if it's in certain parts. Okay.
Of course, of course. If you are overweight, you can start doing some exercise, some dieting, some fasting. This will help you to reduce your weight. But if you continue increasing your weight, you will have a problem. Maybe you will be exposed to another methods for weight reductions that are more invasive than the regular or non-invasive methods that we are always telling for our patients every day. You have to do exercise. You have to spend your store of energy, which is a fat, to reduce your weight.
Now, this is in the wisdom that behind Allah giving us Ramadan as one of the pillars in Islam, to give our bodies a time to do what the bodies that He created the bodies to do. Right? It allows the bodies to clean themselves and to reduce, you know, these excess energy stores.
Yes.
But I think it's very relevant to the culture that we have as humans in our respective countries. We consume probably too much food.
Of course.
And obesity is a situation, would you agree, that is set up after a sustained practice of eating too much? Is this, or are there other reasons that can cause obesity?
Of course. Eating too much above the extra requirement or above your requirement will render you obese. But in Ramadan, this is a simple training from God for us, training us how to reduce your weight. If you are fasting around 16 hours, for example, you know you will train your body to use his body fat to manufacture the energy that is required for your body organs, for your brain, for your eyes, for your heart, for your muscles. Especially also if this fasting is combined with exercise, it will be good for you to lose your weight. Also in praying, for example, Salat Taraweeh, you spend at least 1 hour in doing exercise. You are standing for a long time. You are concentrating. You are worshipping. This will train your I mean your organs, to use the fat, which is the biggest store of energy in the body, and also the biggest store of water in your body, to manufacture energy and reduce weight.
Okay, so it sounds like the primary cause might be just a habit of just eating too much food and being inactive, poorly exercising. And then also, what would you say about the types of food that we eat and how it sets up obesity? Certain foods, do they give us more excess fat than other foods?
We have to eat, as we are learned from primary school, we have to eat balanced diet.
Yes.
That include all elements of food. If you have to eat protein, you have to eat fat, carbohydrate, you have to eat vitamins, minerals, and everything. If you are not eating fat, for example, you will have a problem with your body. You have to eat a balanced diet. You have to eat ideal amount of food to have good health.
All right. Now, once we have a situation of obesity, there's something that we have to do about it. If we don't, it could potentially threaten our lives or give us serious health conditions. What are some of the options for dealing with and treating obesity?
Okay. Options for treatment of obesity are classified into two big categories. One is non-invasive procedures, and the other one is invasive procedure. Non-invasive include exercise, eating, changing of your lifestyle, eating a balanced food, as I said. We can take some medicines or some herbals to reduce weight, for example. And this is a simple. And also, as a plastic surgeon, we may have a role in certain kinds of people. I mean, they have just overweight and they are not able to reduce their weight by simple methods like that. Or most of the patients coming for my clinic saying, doctor, I had some regime to reduce my weight. I did it for 3 months and I already get reduction of my weight, but I regained my weight again. So I have to help those patients by doing some liposuction for them, which is not much invasive surgery. But the next class or next type of procedures for weight reduction is invasive or surgical interventions for reducing the alimentary canal, I mean stomach size, which is called bariatric surgery. Through this bariatric surgery, we can reduce the capacity of the stomach by insertion either of a ring or something like that, or insertion of a balloon inside the cavity of the stomach to reduce its capacity. We can also excise part of the stomach to remove the store of food in the body. And this is an invasive. But we have something very important, that most of the patients coming for plastic surgery clinic, and they are aiming, or their main concern is weight reduction, and this is not right. Weight reduction is by other methods. We have a little role for that, but we are dealing for those patients after losing their weight.
So plastic surgery as and its relationship to obesity, traditionally, when I think of plastic surgery, I think of, someone who wants to try and maintain a youthful look. They get a so-called the facelift. I just can't conceive of the types of things. You said liposuction. Is this an example of the plastic surgery that's done?
Plastic surgery is two also big categories. One is for cosmetic reason, and this represents around 30% of our work. 30%, 40%, yes. And there is around 60 or 70% of our work is reconstructive surgery.
Reconstructive?
Yes. Reconstructive for dealing with burn patients, for patients that have trauma for their hand, trauma for their face, and also for reconstruction of tumor after excision in the face, in the hand, in the breast, and so on. But for cosmetic reasons, or cosmetic part of our work is, as you said, for face lifting, blepharoplasty, eyebrow and forehead lift, and also some other office work like Botox injection and so on. But for patients, obese patients, we are concerned mainly about what's called body contouring.
Body contouring.
Yes.
Like shaping the body.
Yes. Body contouring means reshaping.
Reshaping.
Of the body configurations.
Okay.
Especially those patients, they have already lost massive amount of their weight, which is massive weight loss. We call them in literature massive weight loss population. Those patients that lost more than 50% of their overweight. If the patient, for example, his ideal weight should be around 70 kilogram and he has excess weight 50 kilogram more. This means equal he has 1.2 or 120 kilogram. If he lost 25 kilogram, this is called massive weight loss.
Dr. Mustafa, we'll take our first break right now, and then we'll come back to continue talking about obesity and plastic surgery. Assalamu alaikum and welcome back to the program Ramadan for Better Health. We're talking this evening about, we're joined by a plastic surgeon. We're talking about plastic surgery as an approach for dealing with obesity. Before the break, Dr. Mustafa, you were talking to us about certain types of patients who have a massive weight loss.
Yes.
And can you continue talking about these patients?
Yes, massive weight loss, those are patients, as I said, that lost 50% of their overweight, of the amount of excess weight they have. Those patients actually, they have a big problem because suppose you have overweight of 50 kilogram and you lost 25 kilogram. This will be followed by massive redundancy of the skin of their body, starting from the head up to the heel. They will have sagging of their face and atrophy. Most of the patients are like that. Especially those patients, they have already bariatric surgery for reduction of the stomach size. They will have redundancy of their breast and also atrophy, especially in female. It will be annoying for them and also for their partners. Also sagging of the arm, sagging of the abdomen and the thighs, and also they may have corruption or disparity of their body organs or body surfaces for each other.
Got it. So they've lost a lot of weight in a relatively short period of time, either through surgery or through exercise and diet control, and now they have a lot, as you say, a lot of sagging skin.
Yes.
Right.
Yes.
And so they come to you as patients. Please help me,
yes,
to look better.
Yes, to look better, of course, yes.
All right.
And to correct this, abnormal curvatures of the
curvatures, yeah, okay. All right. So talk a little bit about the procedure itself, the body contouring.
Yes. Body contouring is started actually from the head and the neck. We do facelift for these patients. Sometimes we need for these patients that lost a big amount of weight to inject fat, because the face actually respond primarily and massively for weight reduction. And some patients will come with atrophy of their face. So we may inject fat in the face for them to get bigger. We may inject fillers or collagen. We may inject Botox or something like that. We may do a reshaping of the face by face lifting and so on, and the neck lift. The other areas of the body, like the arm, they may have sagging of the skin. We may do liposuction or may excise the excess amount of the skin or sagging skin in their arm. Also, they may have atrophy and the sagging of the breast. So we may do breast reduction and what is called mastopexy. Mastopexy means elevation or lifting up of the breast to its normal position. Also, we may need to do tummy tuck or abdominoplasty or body contouring, as I mean belt lipectomy for the middle part of their body. We may do liposuction or thigh lifting for those patients. So it's a program of work. We are communicating with the patient, or we can say it's not a patient. As a plastic surgery patient is not a patient. He is a client.
I have a question, Dr. Mustafa. Oftentimes, people who have obesity, there's a pattern. They have a set, some habits that have gotten them into this situation to begin with, aside from any medical causes. And it's a struggle to change the behaviors, to reduce the consumption of food, the fatty foods, and to start exercising. So oftentimes we see people go back, they put the weight back on, and they lose the weight and go back and forth. You know, we see celebrities doing this a lot in the, so once someone has had plastic surgery, they've had body contouring, if they gain the weight back, does it set up a special kind of problem?
Of course, it's a problem. Patient, I think patients, they have spent a lot of their time, many years, for weight reduction, and also for doing operations like abdominoplasty and so on. I think most of them, they have to preserve their weight to ideal. Most of them actually, because they have a psychological problem from doing many operations before. So they have to keep their weight ideal. Otherwise they will be exposed to more operations and more complicated operations for weight reduction, and also more complicated operations for body contouring.
And as you said, to repeat what you said earlier, once you have, you know, this extra skin sagging after weight loss, the skin itself, is it just removed? The sagging skin after significant weight loss, do you just remove the skin entirely?
Not only skin. We remove the skin and also the subcutaneous fat with us, and it will end up with a scar from the medial aspect of the medial side of the arm. And this actually is a sequel of the operations of body contouring. You will lose weight, you will remove your sagging skin, will remove your fat, but you will have a scar in the area that we removed or we excised.
Okay, can you talk a little bit about any complications that you might encounter during these surgeries?
First, we have to know that any surgical intervention should carry some complications. But we have to differentiate between complications and sequelae. Also, we have to consider the preoperative preparations, and we have to do the standards of surgical standards to avoid complications. If we do for those patients preoperative preparation very well, because most of the patients that lost a big amount of weight, they will have some sort of malnutrition, or they will lose some kinds of vitamins and minerals, especially those patients that have stomach reduction or excision of part of the stomach. We call it gastric sleeve. They will have deficiency of vitamin B12, for example. They will have low minerals, and they will have anemia. So we have to correct all of these problems before any surgical intervention for these patients. Otherwise, you will have a complication. But as I said, we have to differentiate between complications and sequelae. Sequelae, it will happen like the scar after operation. If you excise your excess skin from the lower abdomen, for example, or your breast or arm, you will have a scar. This is a sequelae, not a complication. And also we instruct our patients that these scars need some ointments, some precautions, maybe laser to improve later on. And this is sequelae. But complications are, as I said, it's different.
Now, some people are considering these kinds of surgeries. You know, you have to plan for them. What about anyone thinking about performing this surgery during the month of Ramadan?
Actually, I don't do these operations at the time of Ramadan because it is an elective surgery. Why I have to do elective operation? And you are deprived from the hasana of fasting of Ramadan.
Yeah.
So I don't know these operations during Ramadan. I postpone. I ask my patients come after Ramadan,
Yes.
and we can do this operation.
Okay. Now, I imagine that your patients are more women than men, but you also see men as well.
Of
Is that
course,
correct?
of course.
All right. So, what is the breakdown, the percentages?
Percentage. Yeah, I think women more than 90% than men.
I'm sorry.
90%.
Are
The people I am facing here for weight reduction, I mean for body contouring,
yes.
are mainly women,
Okay.
not men.
Uh-huh.
The percentage of men are little in comparison to them because maybe the men are working and the women are staying more in home and they don't do exercise, they are not moving and so on. So they gain weight in comparison to men.
Got it. Okay, so like all doctors, before you take your patient and go through, you listen to their history, you want to understand their habits. When you screen your patients before performing this procedure, do you ever discover something that disqualifies someone from having these procedures?
Of course. We don't have to do body contouring surgery on the patients that are still going reducing weight. Any patient, he should have his weight stable for at least 6 months before I have to touch my patient, or I have to put my knife in my patient. Otherwise, he will have more more increase of weight, and he have resagging of the skin,
yes,
and so on.
Yes.
So we have to be sure that the patient finished the weight reduction, weight reduction time.
Yeah. I asked you before, I want to revisit an earlier question about resagging. This was the term I was looking for. So you have a patient, they go through the procedure with you, the plastic surgery for obesity, but then maybe they gain the weight back. Is this what you mean by resagging?
Yes, of course. Resagging of the skin. They have to be stable.
So the skin replaces itself. It'll grow back. Is that what causes or allows the resagging?
That is why we instruct our patients after weight reduction and after body contouring. Please, please, please keep your body. Keep your body weight. You have to continue on exercise. You have to continue on the balanced diet, on the healthy food.
Yeah.
You have to fast at least 2 days every week. This will help you a lot to maintain your weight to ideal. Otherwise, you will have recurrence of your problem again.
Got it. And then after they've actually performed the surgery, do you require them to come back to see you? And what about the rates of success? How many patients are actually successful and they're solved their problem with this?
Most of the patients are motivated to lose weight and to have their body shape normal. Most of them. Because, if the patient, she is overweight and she has obesity and she has a problem with her skin, always partners, classmates, family members, friends, they are accusing them that you have a problem. Most of the patients are motivated to solve or to have a final solving of their problem. But we have a little of these patients that have what's called the body dysmorphia. They are not accepting their body. They are always standing in front of mirrors and they are comparing their body shape with the body shape of others. Even I did for them body contouring surgery like abdominoplasty, like breast reduction and so on. They are concerned about the scars of these operations, and how about if I don't have scar of these scars? We are sending those patients actually to psychotherapy to help them and to take some psychological treatment for support.
Okay, Dr. Mustafa, I am sorry to cut you. I'm sure there are many other aspects of this that we did not get to, but this at least allows the viewers to understand more about these procedures, plastic surgery as a way of treating people with obesity, and again, as we've said before, prevention. Do things before you find yourself in an obese situation. We hope this was beneficial, inshallah. This was Dr. Mustafa Mikki. He is a plastic surgeon. He works as a professor and as a practicing physician, a surgeon at Al-Azhar University. Thank you so much for being with us, Doctor.
Thank you very much.
And thank you, dear viewers, brothers and sisters, for being with us. We'll be back with more, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.